Hi, my name is Dr. Kelly Clarke, and I wanted to talk today about many of the questions I get regarding psychoeducational assessments. For the past 20 years, I have been engaged in performing psychoeducational assessments in the Edmonton area and as well throughout all of Alberta. I've been to places such as Hinton, Jasper, Edson, Calgary, out down south. So I've actually done psychoeducational assessments throughout most of Alberta, but mainly specifically dealing with the Edmonton area. And over this past 20 years, I've done thousands of psychoeducational assessments. So during that time, I've had some fantastic questions, great questions that I thought I would talk about today regarding psychoeducational assessment. The first question I would like to answer is, what is a psychoeducational assessment? Psychoeducational assessment is using psychological and educational measures to determine children's and adolescents' abilities to perform in school. So often we use measures that are standardized tools that have both been shown to be valid and reliable measures of the areas that we measure. We measure areas like cognition, academics, emotional and behavioral areas, and several other areas that we look at in cases where there's more specific needs. But those are the general areas we look at: cognition, academics, emotional, behavioral. Why do we do those three areas? Well, cognition is an IQ test. This gives us good information about learning style. Are they a stronger verbal reasoner or auditory learner, listening learner? Are they a stronger visual learner, hands-on learner? The cognitive tests give us good information around that. They also give us information about working memory, which is a bit different from short-term memory. Short-term memory is just the ability to hold pieces of information like 1, 2, 5, 7. So short pieces of information. Working memory is the ability to manipulate that information. So saying those numbers in reverse. So you'd first of all have to remember them and then also manipulate or say them in reverse. So we're seeing a student's ability to remember information and manipulate that in their memory. That's essential for learning, absorbing information. Children, adolescents, and adults that have difficulties with working memory invariably have to go over information again and again for it to sink in and have difficulties absorbing content in the classroom. So it's important to get this information so we can learn more about how they learn and absorb information in the classroom. We also look at processing speed. How quickly an individual can work through visual information explains why they may take longer than, say, the next student. So we get a lot of rich information from IQ tests. We also want to take a look at what we call achievement tests or academic tests. So we're looking at reading, writing, and math. So a parent or a teacher may say, I think that this student has difficulties reading, writing, and math. So we'll actually use a standardized assessment to see where this student's ability or skills fall in comparison to most students their age. Then the last area that we typically look at, if there's a need, so we would look at intelligence and academic if there's primarily difficulties with learning, whereas we look at emotional behavioral if there's difficulties with behavior. So this would include things like emotion, depressive features, obsessive compulsive tendencies, ADHD, these kind of things, and even in some cases, autism. We might be using these instruments almost like a screening tool to recommend further assessment for autism. So psychoeducational assessments can give all of this rich assessment information, and that is what a psychoeducational assessment generally is. Another question is, why does my child need this assessment? Generally, why a teacher or a parent would look at getting an assessment is that clearly your child is not developing at the same pace as, say, typically observed in the classroom. So teachers are a great resource for this because they have 28, 30 other children to compare with. And they also use standardized tests themselves to take a look at reading, writing, and math skills. And so they're great, excellent resources to come up to a parent and say, you know what, your child is not developing at the same pace. So it's often we will look at a psychoeducational assessment if the student is developing much slower than, say, their peers. This may also reveal learning disabilities and or the presence of other factors that might influence learning, such as ADHD. So that's one of the why we would want to look at a psychoeducational assessment. What kind of tests do you use to assess these things? So we do use standardized measures. Often we'll use the Wechsler Intelligence Scales for children, the 5th edition, the Wyatt Achievement Test, 3rd edition. There's a 4th edition now to look at reading, writing, and math. We also look at things like behavioral measures, such as the behavioral assessment system and other measures that teachers and parents fill out, as well as children and adolescents, to describe their own behavior, and it gives us rich information around these things. There's more assessment materials, and certainly consult at my website if you have more questions about this. How long does the assessment take? Usually, like a cognitive academic will take about 3 hours to complete. Often I will complete these in the school setting in a quiet room. But in my office, it takes about the same time. And in other cases where we're looking at emotional behavioral, clearly the child is having some emotional or behavioral difficulties, there would be an observation period in the classroom of say approximately an hour, and consultation with principals, vice principals, teachers, parents would be in addition to that time as well. They're often, out of this rich information comes diagnoses such as ADHD, learning disabilities, dyslexia, dyscalculia, disorder of written expression, which is a writing disability, these kind of things. And even, specific assessments which are more catered and more in depth to measuring things like autism can be accomplished as well with additional testing. How should I prepare my child for the assessment? Usually it's great to have your child to have a good sleep the night before, a good breakfast, and basically just to have, talking to them about that today we're going to learn about how you think and reason, as well as learn about your reading, writing, and math skills. So that's almost as simple as I will say it to the kids. And of course, I will give more detail to parents about preparing, but that is a simple and brief way of preparing for an assessment. And then again, the results will also give us rich information about how your child learns best. And what happens after that is that there's often recommendation for an individual program plan at the school where specific targeted areas are written out and documented by school personnel and teachers and targeted for various periods of time for improvement. So often the parents will meet with teachers and school personnel to go over these targeted areas to see how the child's improving. So another benefit of the assessment is to specifically target areas for improvement, and schools will often do this and follow the progress through something called an IPP or an IEP, individual educational plan. Now, once a child has been diagnosed with, say, a learning disability, will they get accommodations in school? And so when there is a diagnosable condition such as ADHD, a learning disability, an intellectual disability, autism, in the Edmonton area, the public school system is fantastic with providing accommodations in the classroom and also suggestions at home. So there's a great interaction and relationship often between school and home when there has been a diagnosed condition through a psychoeducational assessment. In addition, you may be interested in that if a child, say, for example, has been diagnosed with a learning disability, the Alberta government, rather CRA, the Canadian Revenue Agency, will give some tax benefit to a person who has a diagnosed learning disability such as ADHD, such as a reading disability, and there is a tax benefit for parents. So you could apply for that as well through CRA. As far as how long the report takes, how long does it take? Usually it takes about 2 to 3 weeks to have the report completed. And what happens after that, myself or a person that has conducted a psychoeducational assessment will meet with the parents, school personnel such as the principal, the assistant principal, teacher, and any other people that are included in that student's learning course. And then the information's gone over with all of those personnel, and the parent has provided that report. Usually I don't provide a report before going over the results, simply, not that it's not something that parents could use, but it might be confusing, and I just find it's a better practice to be able to go through all those results with the parent. So that would be something would happen at the same time, usually as the report's given. The results, are they confidential? Yes, the results are entirely confidential. For myself, the results that I have completed in a report are kept in a secured digital format that's password protected, and they're entirely confidential. No one can get those results unless the parent gives permission for me to send those. And of course, that conversation happens before they would be sent anywhere anyway. So they are entirely confidential. When the school is organized and pays for the assessment, those results are still entirely confidential and kept in the private database of the school system. So those are some of the questions that I wanted to answer about psychoeducational assessments. If you have any other questions, feel free to consult drkellyclarke.com or certainly give us a call through my website. Thank you for your time.